Little plug for green tea. Of course, we have some in our urn, so I'm sure you've been drinking it. Green tea is a wonderful anti-inflammatory resource for the body. It's something that can prevent cancer, because largely what it's doing is promoting detoxification of the liver. It's promoting our liver's ability to break down and excrete toxins in our body. Because as we change our diet and we get healthy, we still also have a lot of toxicity from before that's sitting in our body, right? This is when we are feeling so much better, but there's still this weight carrier that we just can't let go of. A lot of it is just stored up toxins in the body, and green tea can be very helpful to drain it. It's also a diuretic, so you want to make sure you're also drinking water in addition. It's not a substitute for water, but it's a really important thing to drink. If you're getting green tea in like Celestial Seasonings bags and things like that, it's probably very low quality, so it's not going to be very medicinal. So that's not necessarily, if you're going to drink a lot of it, it's not the best way to do it. We do have green tea here that we import. There's also the Green Tea House in Blueback Square in West Hartford that has awesome green teas.
What about yogi teas or whatever?
You know, I've seen yogi teas. I don't know what kind of the packaging is. The ideal is to do loose leaf. That's really the ideal, because then there's no glues and dyes and anything that's sort of getting in the way of you getting the benefit. And the other thing with those types of packaged teas, you don't know how long it sat in the package. And you don't know what sort of temperature fluctuations in the factory and this and that. Green tea, like the green tea that we get straight from Taiwan, we get it straight from the farmers. We've been using this for like 20 years. And it's loose leaf, and we know that it's been packaged in a way that's going to protect it. Right? There's no sort of bags or anything that are going to get in the way of it.
And it's pesticide free.
It is, yeah. We know the farmers. We've gone and visited them, yeah.
So what about, I've had a notion that I cannot drink green tea because of the caffeine in it. Is that a myth?
So Jan is asking about the caffeine level in green tea. If it's very natural, the caffeine level is definitely lower. But I will say that some of our more caffeine-sensitive clients are able to drink green tea and not have the caffeine effect. There are some clients that are definitely, they don't feel good when they drink it, and you have to trust that. Especially if it's really good quality green tea. And it could be also that it's too much detox that it's promoting, and that it's not the caffeine that they're affected by, but that it's too aggressive for their body. It's creating a process of bringing too many toxins into circulation, and it's just making them feel not great. So it's not necessarily the caffeine. But I will say the better quality of green tea, the less the caffeine is an issue. But if you're drinking it and you don't feel good, you should stop drinking it. You don't want to push yourself. You don't want to force yourself to do something that doesn't feel good. You want to trust yourself.
So the so-called naturally decaffeinated green tea would not be a good choice.
Well, that means it's gone through a chemical process.
So it's not naturally decaffeinated.
Right. No. Well, natural decaffeinated, yeah, it's sort of an oxymoron.
Say that again?
It's an oxymoron.
To say
naturally decaffeinated.
I see.
Naturally decaffeinated. Yes, Louise.
I'm one of these strange people who can drink coffee, but I can't drink tea.
Any tea or green tea?
Green tea also. But I think a lot has to do with the quality that you mentioned. I think it's super important. And number one is how much you're drinking. I could not possibly drink it all day long. The other thing is I'm on anticoagulant. And green tea is counterindicated for anyone on Coumadin or warfarin.
Yeah, it's true. You know, for people that are on anticoagulants like Coumadin or heparin, they're blood thinners, there are definitely certain things that promote blood thinning, right? Certain foods, certain drinks. Green tea is one of those. So you have to be cautious. You know, you're cautious with how much, you know, omega-3s you take. If you're on certain medications, you want to definitely talk to your doctor, ask them what they're comfortable with. Some of them are comfortable with a small regimen. Some of them are not comfortable with it at all. You just have to ask and go through the process of learning about that medication and what your own body can tolerate. But if you're not on those types of medication, you got to see how you feel with things and trust yourself. Trust your instincts on if something doesn't feel right, then it probably isn't, right?